The today's topic is yoga for bone health, bone density, and osteoporosis. And the speaker will be Srimati Gautami Darvesh ma'am, and I'm happy to introduce Gautami Darvesh ma'am to the group. She is a certified yoga trainer and has completed 500 hours of teachers training, with the recent advanced teachers training being from Himalayan Yoga Valley, which is an international yoga education hub. She has also done training courses in the various traditions of like Sri Krishnamacharya and Bihar School of Yoga, Swami Satyananda. She has also completed YCV level 3, and she is actively engaged in taking yoga classes in various forms. She is also a faculty at Oordhvam. I warmly welcome Gautami Darvesh ma'am to continue the show.
Thank you, sir. Hariom. Thank you for the introduction. So the topic for today is yoga for bone health, low bone density, and osteoporosis. This topic has been specifically chosen to discuss the benefits of yoga for persons who are going through this condition, which is low bone density, and also to introduce some safe patterns of movement, not only in the asana practice, but also in our daily patterns, and also to see if there are any negative patterns of movement in asana practice and in our daily life, which is injurious to anyone who is going through low bone density, or also to normal persons if it is injurious to them in the long run. Okay. I will share my screen. Is my screen visible?
Yes, ma'am.
Is it visible now?
Yes, ma'am.
Yes,
Okay.
yes, ma'am.
Okay. Thank you, sir. All right. So we will start with the presentation. The subtopics that we're going to discuss today are the concept of bone remodeling. We'll understand the concept of bone remodeling to understand what is low bone density. We'll understand what is normal bone density, low bone density. We'll understand what is osteoporosis and what is osteopenia. We'll understand what are the factors that contribute to low bone density. We will understand what are the tests to be undertaken to assess low bone density. We'll also understand how to read the report in case you want to really assess the scores. Okay. Next, we're going to look at the basic anatomy and physiology related to low bone density. This is specific only to low bone density. So the better you understand these basic concepts, the more motivated you will be to make changes in your daily patterns and also in your asana practice. Next, we'll try to understand scientifically what are the approaches to build bone, and if yoga really helps in building bone, and what are the researches conducted and what are the conclusions made. We're going to look at that, and we'll also see some asanas that will help you in building bone if it does. And at the end, we're going to look at a practice plan that you can incorporate in your daily life for a bone, which will be obviously a bone healthy practice. Let's start with the first concept of bone remodeling. So as I said, to understand the concept of bone density, we need to understand what is bone remodeling. Bone remodeling is basically a process in which there is breakdown and buildup happening. So in a normal bone, there are different types of cells. For our discussion, today we're going to only discuss about osteoclast and osteoblast. Osteoclasts are cells which are responsible for breakdown, and osteoblasts are the cells which are responsible for buildup. So this buildup and breakdown constantly happens in a bone. As long as the buildup and breakdown is happening, there's a bone remodeling that's going through. To maintain the health of the bone, to maintain the density of the bone, this process continuously takes place. It can be compared to a house in which there's a repairs and maintenance. In every house, you see repairs and maintenance. There's some workers who come who break down the damaged parts and reconstruct whatever is required. It's just like repair and maintenance, which normally goes into the bone as well. As long as the breakdown is equal to buildup, which means the cells of breakdown are equal to cells of the buildup, the bone will be considered to be normal. Or if the cells which are responsible for buildup are more than the cells which are responsible for breakdown, it'll be a normal bone. Now we'll go ahead and understand what is low bone density. In low bone density, there's basically an imbalance in bone remodeling, which means the cells which are responsible for breakdown are more than the cells which are responsible for buildup. The osteoclasts are more than the osteoblasts. This imbalance will cause low bone density. Okay. In the lifespan of an individual, the density varies. You can see a graph on the screen. In that graph, on the x-axis is the age, and on the y-axis is the bone mass density. If you look at the graph, the curve increases and it becomes constant for certain duration and then it declines. This has to go actually with the age, wherein from the birth till around 30 to 35 years of age, a person reaches peak bone mass, wherein the osteoblasts are typically more than the osteoclasts, or the buildup is more than the breakdown. But around 30 to 40 years, between 35 to 40 or 45, it will remain constant, which means the cells for breakdown and buildup will be equal. But after 45, there's a declining trend where the breakdown will be more than the buildup. When this happens, there's going to be a imbalance in bone remodeling and there will be a loss in the bone mass. This is a very general figure. It has nothing to do with WHO. These ages are it's very generic. But we'll look at certain standards set by the WHO in the next slides. Now we'll look at factors which are responsible for low bone density. Age, as we have seen, age is number one criteria. Generally, women undergo loss in bone density after menopause. So if we look at the gender, it is early in case of women when compared to men. This is very generic. If it is 50, 55 or 60 for women, it could be 5 to 10 years ahead for men. Women, especially for two reasons, they undergo low bone density. One is due to lowering levels of estrogen at the time of menopause. And at the time of menopause, a woman moves from Pitta dosha to Vata dosha, which is again a contributing factor for this. Genetics. If you have a family history of low bone density, then there's a possibility that there's going to be this condition. Diet. Inadequate calcium, inadequate vitamin D, inadequate essential minerals for bone health. If someone is lacking in that, then obviously it will contribute to this condition. Lifestyle factors such as heavy smoking or too much of alcohol, which inhibits the absorption of essential nutrients for bone health. It could be a sedentary lifestyle where there's no exercise at all. It could be someone who is very, very lean. These are the factors that contribute again to this condition. In medical conditions, certain medical conditions like kidney disorders or rheumatoid arthritis or gut issues, wherein gastrointestinal issues where the nutrients are not being absorbed by the intestine, this could contribute again to this condition. Medications such as steroids, or there could be other medications which interfere in the absorption of essential nutrients, can even cause the low bone density. So these are the factors. Some of them are controllable factors and some of them are uncontrollable factors. The first three are mostly uncontrollable factors, but diet, lifestyle factors, medical conditions, and medications are controllable, provided we have enough information about it. After understanding the concept of bone remodeling, we understood the concept of low bone density, in which the cells for breakdown are more than the cells for buildup. Let us understand what happens in the case of osteopenia and osteoporosis. In osteopenia, there is a moderate bone loss. In low bone density, there is a bone loss, right? In osteopenia, there is a moderate bone loss, and in osteoporosis, there is severe bone loss. In osteopenia, it's a moderate bone loss, and in osteoporosis, it is extreme bone loss. Now, let us understand what are the tests to assess the medical conditions of osteopenia and osteoporosis. Typically, a DEXA scan is done. There are basically two scans, DEXA and REMS, but we limit our conversation only to DEXA scan because DEXA scan is the gold standard. DEXA scan is basically a low-dose X-ray test to measure bone density, and it measures the hip and the spine to understand the health of the bones in the overall body. All right. If a person goes through a DEXA scan, the report shows T-score and Z-score. We'll try to understand what T-score is and what is Z-score. T-score is basically seen for an individual who is above 50 years of age. Basically, T-score is seen to understand if an individual is going through osteopenia or osteoporosis. Z-score is seen in the case of individual who is less than 50 years of age. Okay. In T-score, the comparison is between the bone mass density of an individual who is being tested versus an individual who is a healthy adult. Okay? But in Z-score, we assess the score, the difference between the result of the individual who is being tested versus an individual of the same age, gender, and ethnicity. Okay? The scores of T-score and Z-score are standard as per WHO. Okay. Now, this, if you see, the bar has different colors, red, orange, red, yellow, and green. These are similar to traffic signals. Green, as long as you are in the green bar, you are in the safe zone, which is a normal bone density. If you are in yellow zone, it is osteopenia. And if you are in red zone, it is osteoporosis. This is, I will not tell too much of, not into statistical terms, but in general terms for you to understand. If you are at -1, it means there is 10% of bone loss. If you're at -2, there's 20% of bone loss. In T-score, we compare the results of the individual who is being assessed versus an individual of a healthy adult. Okay? So this is how the results are seen. The numbers will slightly vary from T-score to Z-score, obviously, because in T-score, the comparison is with a healthy adult, and in Z-score, it is with the comparison of someone who is of the same age. I have given an extract of a DEXA scan report of an individual who is about 40 years of age. And in that, you see T-score and Z-score. Since the individual is about 40 years of age, the score that has to be seen is Z-score. If you see so as I said, DEXA scan measures the hip and the spine. In the spine especially, it measures only the lumbar area, and in the hip, it is the left hip and the right hip that is assessed in the DEXA scan. So in your reports of the DEXA scan, it will consist only of the lumbar area. Taking the average to be at -1 for this concerned individual who is about 40 years of age, the bone density, so the bone loss is about 10%, -1. If it's at -1, still we are in the green bar in the Z-score, which is a normal bone density. Hope this is clear. We'll move on to the next slide. Now, in DEXA scan, we have seen it measures the hip and the spine. We will understand why DEXA scan really measures only hip and the spine to assess the health of the bones. Okay? Basically, the bones has various tissues, but for today's conversation, we will limit to only cortical and cancellous tissues, or cortical or cancellous bone. Cortical bone is basically the outer surface, which is harder in structure. It can be compared to the outer walls of a house, which provide structural support, just like the bones provide the structure to the body. Cancellous bones are softer in nature. They're also called as soft and spongy bones. In the inside, it is because of its soft nature that it provides flexibility to the bones. Right? Cancellous bones can be compared to the internal framework of the house that provides flexibility. Okay. The reason why DEXA scan measures only spine and hip is because it's the spine and the hip which has majority of the soft bones. Okay. Because the spine and the hip has majority of the cancellous bone, this is an indicator for the overall bone health of an individual when it is being tested in a DEXA scan. We'll try to understand some basic anatomy and physiology related to bone density. We have seen the spine and the hip, which were the indicators in a DEXA scan. We'll try to understand basic anatomy of the spine and the hip, and core muscles and hamstring muscles. Core muscles and hamstring muscles, this anatomy again, we will look at to improve the health of the spine. Okay. The better you understand these concepts, the more motivated you will be to make changes in your daily patterns and also in your asana practice. Let us look at the anatomy of spine. So So we can compare the spine to the trunk of a tree. Just like the trunk of the tree protects its branches and withstands any stresses and the winds, similarly, the spine provides stability to the body and it distributes the weight to the lower body. Basically, the body is stabilized because of the spine. It allows for movement. If you look at the spine, there are various curves in the spine. These curves are essential for maintaining the health of the spine. If you see, the forward C curves and they are backward C curves. The forward C curves that you see are the thoracic and the sacrum to coccyx. And the backward C curves are the cervical and the lumbar. The reason why I'm telling forward C curves are developed at the time of birth and the reverse C curves are developed after the birth. Most of the issues that arise is from the backward C curves, which are the cervical spine and the lumbar spine. And we will see how and what are the postures. Okay. Now, when I was discussing about DEXA scan, we discussed that the spine consists majority of soft bones. Now, exactly where in spine does it consist majority of the soft bone? So basically, the spine consists of vertebra, which are bony structures, and disc contain nucleus. It is because of it the disc allows us to freely move forward, backward, and from side to side. Okay, and the anterior spinal column, this anterior spinal column and posterior spinal column, we are going to look today only at the anterior spinal column, which consists of the vertebra and the disc. Right, the posterior column contains of other bony vertebra. We are not bothered. It is only in the anterior spinal column, which is the vertebra, which has maximum percentage of cancellous or soft bones. So we'll be more focused on the vertebra, on the disc, and we will see what happens if it is compressed. So basically, whether it's in our yoga postures or whether it's in a daily movement, we take the spine out of its natural curve several times during the day. We'll look at certain postures which are harmful to the spine. In general, we'll move on next to yoga, but in general, let us discuss first in general to build in some awareness. We'll look at the first graph. If you see on the x-axis is the position of an individual, and on the y-axis is a spinal load, percentage of spinal load precisely. So in a lying position, the spinal load is about 25%. In a posture which is in lying but towards one side, the load of spinal column is about 75%. In standing upright posture, where the normal curves are maintained, the spinal load is about 100%. So which means if you bend, the spinal load is going to increase. So in a forward standing posture, if someone is lifting heavy weight, the percentage of spinal load can increase up to 220%. Okay. And the spinal load when in the case of sitting is more than the spinal load in case of standing. If you see 100 is for standing, 100 is spinal load for standing, and 140 is spinal load in the case of sitting. Basically, the seated postures are more compressive on the spine due to the gravity. Because the spinal cord is in touch with the gravity, the compression increases. So that is why the spinal load is more in case of seated posture. It can increase up to 275% in case of a slouching posture, and the person is holding something, you hold or you're weighing something in a seated posture and rounding your spine. You are compressing your spine, and we have seen that it was the front portion of the vertebra which is being compressed. And I said it's the front portion of the front portion of spinal column which consists of vertebra, and this vertebra consists majority of the soft bones. Okay. Now we look at some more postures. Seated postures are basically more compressive on the spine because of the gravity, as I discussed. In seated posture, the lumbar will get flattened because of gravity, and because basically the disc gets compressed in almost all the majority of seated posture, unless and until you're consciously in a straight upright posture where the curves are maintained. There's obviously a load on the lower back and flattens the lumbar area. Okay, to counter this, one advice is to move from a passive seated posture to an active seated posture, which means if somebody is sitting for a longer duration on a chair, it is suggested that they move from an active to a seated passive posture. In an active seated posture, the spine will not be rested against the chair and you will maintain the natural curves. Whereas in passive seated posture, you will rest your spine against the back, in which there is going to be some compression. In active seated posture, there's lesser compression, and in passive seated posture, the compression is a little more. Switching on from active, you basically, once you're in active posture, you switch off to passive posture unconsciously, and this movement from active to passive will reduce the compression on the spine. Okay. We look at some other normal postures as well. We are seeing a picture in which a person is looking at his mobile phone. The weight of the head on an average is about 5 kgs when it is placed on the neck, and the shoulder is supported by the shoulders. Okay? If the position of the head is shifted to 15 degrees, and just to 15 degrees, the weight is more than a double. It's just 5 kgs. It's normal at its when the spine is in normal curve, it is 5 kg, whereas it increases to more than double by just a 15-degree angle, and it can max out to almost 27 kg in 60-degree angle. So this actually, it is because of this that causes compression in the nerves in the cervical area. Okay. Now we look at certain posture movements of the spine in yoga postures. Okay. We have looked at the movements of the spine in routine postures. Now we will look at movements of the spine in yoga poses. In the various movements, the first movement is elongation. In elongation of spine, the spine is elongated from the base of the hip till the crown of the head. So in certain postures, such as Vajrasana, you can maintain the normal curves of the spine. But in certain seated postures, in certain postures in which you're elongating the spine, you do not maintain the natural curves. You get out of the natural curves. Getting out of the natural curves during yoga will help you create space in the vertebra. By creating the space, obviously we're countering the compression that is happening in our daily life. Just a second. Yeah. Elongation of the spine does not allow for compression is one. So because we are countering compression that happens in our daily life, this is one of the most safest. Elongation of spine is one of the most safest movement in yoga. We'll look at other movements. The other is forward bending. In forward bending, there is compression in the spine, especially in the lower back. The compression of the spine depends on the degree of the bend that is involved. And if your hamstrings are tight, unless and until you bend from your knees, you'll be forced to bend your spine, which again compresses the spine further. And we'll look at the safe patterns of how we can counter this. In the side bend, like in Parsa Tadasana, in case of side bend, again, there's a compression happening. Again, it depends on the bend that the compression could be more. The compression is actually happening in the vertebral disc, where one side of the vertebral disc is compressed and the other side is being expanded. Right? In the back bend, again, there is a compression happening in the lower back, as you see in Ardha Chakrasana. In twist, like you see in Ardha Matsyendra, this is an extreme twist where there's a compression happening in the spine, especially in the lumbar area, especially in your upper back. Basically, the twists are more deeper in seated posture when compared to standing postures. Now, we look at the anatomy of hip. We have seen that in the DEXA scan, they generally measure the spine and the hip. We have seen the anatomy of the spine, and now we will see the anatomy of the hip. Now, we will limit our conversation only to few areas which are important from low bone density perspective. We will be looking at the thigh bone and the associated area. So basically, in a DEXA scan, they measure the neck of the femur. Right? In the DEXA scan, they measure the neck of the femur because the neck of the femur consists majority of the soft bones, which are also called as cancellous bones. Basically, the neck of the femur connects the head of the femur and the body of the femur. The body of the femur is called thigh bone. It is because of this that one can do various hip movements. And especially with person with low bone density, this hip movements, whether it's flexion or extension, should be limited because it's the neck of the femur which has majority of the soft muscles, soft bones. We have looked at the anatomy of spine and the hip. We are going to look at the physiology of core muscles and physiology of hamstring muscles, which are important for the spine. Core muscles. There are four muscles which makes up the core. It is the diaphragm, the multifidus, the transverse abdominis, and the pelvic floor. All these four muscles, if they are working in union, it protects the spine and helps maintain the curves in the spine. It can be compared to a can of a Coke. Yeah? If it, as long as its muscles are working together, it is strong as an unsealed Coke. But even if a single muscle, let's say multifidus, is struggling, then the entire system will struggle. If any of the muscle is not working effectively, then the entire system will struggle. Just imagine squeezing a can of a Coke. So core muscles the stronger the core muscles, the healthier your spine are. I know a lot of people may not really give importance during yoga, but this is one of the most fundamental to build on the core muscle, to strengthen the core muscle in their yoga practice, to have a healthy spine, because it is a spine that we use majority, whether it's seated, whether it is asana, whether it's pranayama, whether it is meditation, we always engage our spine during the yoga. Right? We'll be looking at the physiology of the hamstring muscles. Hamstring muscles start from the basically they attach from the pelvic bone to below the knees. Okay, not going too much technical into what are hamstring muscles, but I can explain with the help of with an example. Just like a horse rider controls the horse by holding the reins, similarly, the movements, especially of the knee and the hip, are due to the hamstring muscles. If the hamstring muscles are tight, then there will be limited movement. If there is a limited movement, you will be forced to bend from your spine. Right? Now, we have understood some basic anatomy. We've understood about the spine and the hip and certain physiology that we have seen for the spine. Now we will see if yoga really builds bone. Before we understand if yoga really builds bone, we will understand some scientific things. Wolff's law is a concept developed by a German anatomist surgeon Julius Wolff. So the concept of building bone is dependent on an understanding of Wolff's law. Okay? As per Wolff's law, his theory states that bone in a healthy animal will adapt to the loads under which it is placed, which means that if there is a loading happening on the bone, that loading will cause stress on the bone, and because of the stress, there's a chemical reaction that happens, and because of which the bone forming cells will be activated, which means when the bones are under constant stress, then it helps in bone remodeling. It is like a muscle, use it or lose it. Just like muscles, if you do not use it, you lose it. Similarly is with the bone also. If you use it, you do not lose it, which means if your bone is stressed, you do not lose the density of the bone. In fact, lifting heavy weights helps you to rebuild the bone. Let's take the cases of extremes. Let's take the case of an astronaut. Generally, astronauts are, when they are in the space, they do not have gravity. And when there is no gravity, there is no loading. When there is no loading, there is no bone density, there is no bone remodeling happening. They will deplete whatever, basically the bone cells will deplete at a much higher pace when compared to an individual who is on Earth under the gravity. In fact, astronauts for every month in space, they lose about 1% of bone mass. 1% of bone mass is equivalent to 10%. Sorry, it's 1% of bone mass for every month. Okay. We have seen, Sunita Williams, when she came back to Earth after spending several months in space. I think it's about 9 years, if I'm not wrong. She developed baby feet and she had to be lifted, right? She had to be lifted when she came back on the earth. That is because she developed baby feet. Baby feet is again another condition which is developed because the soles of the feet are not exposed to gravity. Because the soles of the feet are exposed to gravity, it remains harder. When the soles of the feet are not exposed to gravity, it becomes softer. So when it becomes softer, it's difficult for them to to stand on the surface when they have especially stayed for such a longer duration in space. We'll look at another extreme of weightlifters or bone. Basically, the weightlifters' bone density is higher when compared to a normal person. That is because of the loading that happens on their bone, which activates the bone building cells. This is a very scientific understanding of how the bone remodeling occurs, especially, and it's helpful for persons who go through low bone density. Okay. Based on the Wolff's law, we look at the approaches to building bone. There are basically two approaches to building bone: strength training and weight bearing. In strength training, we use either an external weight or the weight of our own body. Our weight of own body comes in contact with the floor, and it is because of this weight bearing that stimulates the bone building cells. In weight bearing, you use an external weight, and because of that loading, there's a compression in the bones which stimulates the bone building cells. Okay. Strength training is basically a very wider umbrella under which the weight bearing would fall, but these are basic approaches for building bone. Okay. From asana perspective, let us see what asanas helps in strength training and what asanas helps in weight bearing. We'll first look at strength training. Certain strength training yogasanas for building bone, which means these postures not only helps in building the strength, but also it helps in building the bones. We will see how. So basically, when again, it's same thing, the same logic that applies. When the weight of the body is in touch with the floor, there's a loading happening. This is weight bearing. When you see Ardha Pinch Mayurasana or Chaturanga Dandasana, this is a weight bearing activity on your shoulders, on your arms. Or in Chaturanga Dandasana, the weight falls also on your leg and the core. So this weight bearing activity will activate the bone building cells. Now, we'll scientifically see what are the factors. I mean, what is the duration for which you will hold the asana for activating the bone building cells. Okay, let us look at asanas for weight bearing. Again, Urdhva Mukha Svanasana or Adho Mukha Svanasana are used for building bone in the upper body, because it is the upper body that comes in contact with the floor. And asanas such as Virabhadrasana or the Vrikshasana pose, it is a lower body that comes in comes in contact with the floor, causing load to the lower body, and it works on building the bone of the lower body. These are postures, but you need to understand how to use these postures for building bone. Yeah. Again, these are also based on Wolff's law only. So there should be an isometric engagement when doing the asana practice for building bone, which means the postures should be held for about 30 to 90 seconds. There should be progressive loading. It is not that you immediately move on to 30 seconds of hold. It depends on the strength of the muscles. It depends on the strength of the bone. It depends on various factors, and it should be progressively. There should be muscle engagement. For every asana, you need to be aware what kind of muscles to engage. So you need to engage those appropriate muscles when you're doing the practice for building the bone. So these three are the basic factors to be considered while doing the asana practice for building bone. Now we are looking at isometric engagement. Let us look at what isometric contraction is exactly. In postures such as Navasana, there is a contraction in muscles, but the muscles will shorten. Okay? Like this is called as concentric contraction. In concentric contraction, the muscles will shorten basically when they are contracted. Completely reverse to it is eccentric, in which the muscles will the lengthen in case of contraction. This is called as eccentric contraction. In concentric contraction, the muscles will shorten, and in eccentric contraction, the muscles will lengthen. Whereas in isometric contraction, the muscles will remain at same length. Imagine doing Chaturanga Dandasana, or imagine doing a plank. There is no contraction or expansion in the muscle. Your muscle will remain at the same length. This is what happens in isometric contraction, and in this contraction only, this contraction is essential to include in the practices for bone building. Now we will look based on the theories of Wolff's law and various approaches. We will see research done by Dr. Lauren Fishman. Dr. Lauren Fishman is a student of late Mr. B.K.S. Iyengar, and he is a doctor actually, but in his regular treatment, in his protocol, he not only includes medicine, but also yogasanas to his patients. In fact, he is a pioneer in treating back pain and osteoporosis. He has conducted studies for about 10 years. His research is spanned for about 10 years. The first research, the pilot study, was for about 2 years. During the 2 years, he has given certain postures that is seeing on the left side of the screen. There are about 12 asanas which were given by Dr. Lauren Fishman in his pilot study for persons suffering with osteoporosis. These postures were held by the individuals who had low bone density for about 30 seconds. Postures were held for 30 seconds, 30 seconds hold, and 30 seconds of relaxation. This was about 10 minutes of practice, and the results were positive. When the results were taken, again, a DEXA scan was used to measure the results. When the results were taken, it was concluded that yoga appears to raise bone mass density in the spine and the femur safely. Of course, the spine, they're talking about spine and the femur because those are the ones that are measured in DEXA scan. And at the end of 2 years, it was a DEXA scan which was used to assess the bone of the health. Right? So he has done about 3 researches. One, the pilot study was for 2 years, and the other study was for about 8 years, in which again the results were positive. The third study was for about 6 months in case of postmenopausal women. Again, the results were positive. The results are basically positive in all the 3 studies that he has conducted. Now, we will look at a yoga practice that is bone healthy. We will see various movements of how we can move safely. We'll also see how we can modify the postures. So in bone healthy practices, first is to engage your postural muscles. When we were discussing about the core and the spine, core muscles and spine, we have discussed that a strong core will contribute to a healthy spine. So in the asana practice, it's essential to engage all the core muscles. This is very, very, very crucial to engage your core muscles. So as per the studies, if a person had one fracture in the spine and continued to do the postures by engaging their postural muscles, the second fracture can be delayed by up to 5 years. Whereas if a person continued to do the postures, if they have one fracture in the spine, they may end up with the second fracture in about as less as 5 months. So that important it is to engage the core while doing your asana practice. So how to engage the core? So basically you engage all the postural muscle and contract your abdomen on your exhalation. Pull your abdomen towards the spine, but at the same time retain the curve in the lower back. This is the right practice to engage your postural muscles. Move on to the next one. In forward bends. In forward bends, bending from the hip, knee, and the ankle is much safer. And again, this comes out of flexibility only. If your hamstrings are flexible, you will be able to bend without rounding your spine. But if it is not, you will be rounding your spine. So it's essential that you bend from the hip, knee, and the ankle. Sorry, you bend from your hip, knee, and from your ankle to avoid the rounding of the spine. And as we discussed, in the spine, it is the anterior portion that has majority of the soft bones, and that will get compressed when you're doing a deep forward bending without engaging your core muscles and without taking the support of your knees. Seated postures. We have seen that seated postures put more compression on the spine because of gravity. So in persons with low bone density, it is suggested to go for lesser seated postures. If you have looked at the postures that are selected by Dr. Lauren Fishman for individuals with low bone density in his test, there are only 2 seated postures, whereas majority of the seat postures are either in standing or in prone or supine. Yeah. The next is back bends. Back bends again increase the compression in the lower back. They are safe to a certain extent only. Go for poses that only moderately compresses your lower back. Don't go for extreme bends, extreme back bends. In case of side bend, it is essential to elongate the spine and then bend. If you elongate the spine and bend, the compression is much lesser when compared to a side bend without elongation. Because when you elongate the spine and bend, you distribute the side bend evenly throughout the spine and your hips, which causes lesser compression on the bones. And in twist, take yourself into the twist as long as your muscles allow. Preferably go for standing twist, because standing twists are much safer when compared to seated twist. Seated twist puts more load on the it compresses the spine more when compared to standing twists. Next is balancing posture. In balancing posture, essential that you allow the loss of balance. If you allow the loss of balance, it will train the body to adjust. Some of them may have the goal of, just improving the balance. So in standing posture, allow for loss of balance so that the body can adjust, provided you have some support within a shorter reach. Next is transition. When you are moving from one posture to another or transitioning from one posture to another, keep your spine elongated so that you are not compressing your spine. Those were some bone healthy practices. We'll look at modifications for some postures, like seated forward bend. In Paschimottanasana, for example, to maintain the normal curves of your spine, it is essential that you put something below your hips. You can either place a cushion or a blanket to keep the normal curves of the spine. And to avoid rounding of the spine, bend your knees or use a belt. You can either, of course, you can do both of them. You can bend your knees and use the belt so that you do not round your spine. In standing forward bend, similar logic applies, where you need to bend your knees to avoid rounding of the spine. In standing forward bend, such as Ashwasancharanasana, you can modify the posture by placing the blocks underneath the palms to avoid rounding of the spine. Okay. Now let's look at lateral bend. In lateral bend, to distribute the side bend evenly through the entire spine and the hip, just move your hips to one side. Inhale, lengthen your spine, and then get into the bend. This avoids deeper compression. Or in balancing poses. In balancing poses, to allow for free hip movement, bend your front knee. Bend the knee of your front leg. If the front leg is in a straight position, it does not allow for freer hip movement. I know this may sound very theoretical for yoga teachers who are attending, but if you practically do it, you will really understand that when you bend the knee, you will allow for freer hip movement. Now, let's look at yoga postures that individuals who are dealing with low bone density will have to necessarily avoid. postures which are very compressing to the spine, like extreme back bend, extreme forward bend, compresses the spine, especially the anterior portion, which consists majority of the soft bones, and it is injurious. In fact, it can also lead to irreversible damage if this kind of postures are done by people going through low bone density. Let's look at inversion. In inversions, there is excessive strain on the cervical area. Or in something like halasana, again, there's excess strain on the cervical area. So one has to avoid extreme compression to avoid any damages. So for improving the bone health, it is not just the asana. We'll also have to look at the mental. It's not just the physical aspect. The mental health should also be considered, because the mental health impacts the physical health. In fact, each and every thought that we create has an impact on each and every cell of our body. So mental health and osteoporosis are basically linked because of one prime reason, because of stress. The more the stressful thoughts, it would trigger an early low bone density because of a hormone called as cortisol. When a person is stressful and creates a lot of a stress, the hormones which are responsible for stress, cortisol is generated basically, and they hamper they actually inhibit the bone formation cells, which can actually cause for early low bone density. So it's necessary to include practices such as meditation, visualization, relaxation, positive thoughts, and emotion for improving the bone health, not only from a physical perspective, but also for mental health. Now, integrating yoga into your daily life, let's look at a practice plan. Let us look at a step-by-step approach to create an effective plan. Establish specific goals. This means that every individual who is designing a practice for themselves will have to understand what are the limitations, what is the health of the bone, how much is the bone density, if they have any injuries in the past. All this should be considered before putting up what the goals are. So the goal could be anything. The goal could be either to build flexibility or to build strength or to build bone. The goal could be anything. So first, it should be, if there's no one size fits all approach for someone who is going through low bone density, because there are various factors, and there various and each individual's limitations vary. So the plan should basically be a tailor-made based on specific goals. Next, seek professional advice. You can seek the advice of an able and competent teacher who has experience in dealing with low bone density, because they may help you to put in certain asanas which are helpful based on your goals. Select appropriate posture. The posture should basically be selected based on whatever your goals are. Like if you want to build balance, incorporate a lot of balancing postures. Or if you want to build strength, incorporate those asanas which will help you build strength. Or if your goal is to build bone density, incorporate those postures which cause loading on your bones. Gradual progression. Initially select beginner-friendly postures. Do not go in for intense postures. For persons with low bone density, going in for intense postures may cause damage to the spine. Warm-up and cool-down postures. Every practice should start with a warm-up to build in some flexibility. And once you achieve some flexibility for a few minutes, you can then move on to the postures and then proceed to cool-down postures towards the end of your practice. Frequency and duration. Typically, for beginners, the frequency should be about 3 days a week, and the duration will be around 20 to 40 minutes. You can increase the frequency and duration once you're accustomed to doing the postures, and you have spent some time doing the practices. Alignment. Ensure that you maintain the alignment for each posture. The alignment varies for types of postures. Maintaining the alignment is essential so as to not injure yourself. Breathwork. Incorporate breathwork during the asana practice and also before the asana practice and after the asana practice, because when including breathwork, we are also taking care of our mental health. Awareness. Be aware of your body in the space. Be aware of what's happening inside your body. This will help you to understand if there is a pain. For example, if there's a particular stance that's that is causing pain, then be aware of it. Once you're aware, you will try to either, move or modify the pose or, relax. So just be aware so that you avoid injuries. Progress tracking for your practice. Just note down what are the asanas that you're doing. Note down what is the duration of the time that you're holding each of the posture. How do you feel before the practice? How do you feel after the practice? When you track all this, you will be motivated to move on your journey. Yeah. Changing strategy is essential to be changed because your body evolves, right? Once you have, let's suppose you have set up a goal for strength building initially, because your ultimate goal is bone building. Once you selected postures for strength building, you can move on to later, you can move on to bone building. So because your body evolves, change your strategy. Now, when designing a practice plan, it's essential to maintain a balance between strength, flexibility, and relaxation. Okay, just choosing flexibility. Let's suppose my goal is to build bones, but I choose those postures in which there is flexibility, which means I'm not choosing the postures that will develop strength or put a constant load on my bones, which means I will not achieve my goal. For for healthy bones, it's essential to maintain a balance between strength, flexibility, and relaxation. Let's suppose I choose only strength and flexibility. I might build bones in the physical body, but at the level of mind, I may not be peaceful. If I am still stressful, the cortisol hormone will have an impact on my bone health, and my practice, it will not be a holistic practice. So it's necessary to maintain a balance between strength, flexibility, and relaxation. Okay. Let us look at holistic approach for bone health. It is not only just asana, pranayama, meditation. These are all, I understand, one aspect of it, but there are other factors apart from this, apart from moving in your normal life, which will help you to improve the health of the bone. First, we will look at the diet. Preferably to have a wholesome diet, because a wholesome diet will provide you adequate nutrition required for the health of the bone. Listed on the screen are some natural sources of calcium. Most important is the calcium and vitamin D for the health of the bones. So for calcium from natural sources, there are sesame seeds, soybeans, almond milk, coconut. These are all the natural sources for calcium. In case of menopausal women, to prevent osteoporosis, chewing a handful of white sesame seeds will provide you the adequate daily dosage of natural calcium. Let us look at other factors. Sun, it's also called as vitamin sunshine, which helps you with vitamin D. Exposing yourself to the sun is essential. Next is hormone balance. Obviously, women go through falling levels of estrogen, or we undergo a lot of stress. So it's essential to balance the hormone with various practices. Hydration. Water is just not essential for hydrating the body. In fact, water aids in delivering the nutrition to the bones. For example, if you have an rich diet, a wholesome diet, and you also had some supplements for calcium, but if your water is inadequate, just remember that the nutrition will not go to the cells. For the nutrition to reach the cell, you need to hydrate your body adequately. Next, avoid fat diets. Fat diets are harmful to the body because your body is deprived of essential nutrition when you have fat diets. So avoid fat diets. Sleep is essential. So aim for about 8 to 10 hours of sleep, because that helps in rebuilding the cells, bone cells, because it's only in deep sleep that our cells are rejuvenated. Next, either avoid alcohol and smoking, or limit the consumption of this both, because it interferes in the absorption of essential nutrients such as calcium and vitamin D. Health check, essential to go in for a health check, because if you do not go in for a health check, you would never know. Typically, a health check is required only after 55 or 60 years of age. Or in the cases, or if you have any of the symptoms of low bone density, you can go in for a health checkup. Right? Now, we are almost towards the end of the session. We have seen various postures which are damaging to us in the day-to-day life. We will see about 2 practices to address this postural shift. As we have seen, sitting posture compresses the spine and puts load on the lumbar, in fact, flattens the lumbar. And in the second case, when we've seen the case of an individual using a mobile and rounding the cervical area, which compresses again the nerves in the cervical area, which is damaging again. And we will see how in yoga practice we can try to build awareness to have our spine or to maintain the spine in the natural curves. We'll first look at Brugger's exercise. Brugger's exercise is also known as a relief position. This can be done by individuals who are actually sitting for a longer duration on chair, basically desk job. People can do this exercise. Doing this exercise will reprogram your nervous system to maintain an upright posture. So basically, this posture will have you can see an individual seated on a block. Instead of maintaining your natural curves, you will slightly deepen your natural curves, wherein your lumbar is slightly deepened and your thoracic is slightly deepened. Maintaining this posture, you will breathe in for a few seconds and then relax. When you do this activity every half an hour or 1 hour, it will reprogram your nervous system and your mind to come into an upright posture. And it also reduces the load on the basically load on the lower back spine. So when I discussed about seated posture, I had informed to get into an active seated posture and passive seated posture. You can alternate between active and seated. When someone does a Brugger's exercise, you'll consciously sit in an upright, an active seated posture. This will help you. The steps are given to the right. You can follow them. Next, in yoga especially, we will see how we can build body awareness to address any postural shift. Stand on 2 blocks, wherein your heels will be on 1 block and the mounts of the toes will be on 1 block. There should be enough of space between the 2 blocks. If the weight is distributed equally on both the feet, you can maintain the natural curves of the spine. All right. If you're moving far to back, you're basically increasing the curve of your lumbar. Or if you move way too forward, you're increasing the curve of your lumbar. Sorry, you're increasing the curve of your thoracic if you move way too back, and you increase the curve of your lumbar if you move way too forward. So before asana practice, for a few days, just check whether you are maintaining the balance equally on the entire foot to maintain the normal curves of the spine. We have seen in the previous slides how essential it is to maintain the normal curves of the spine and what happens if you move out of your normal curves. So this is about it. We move on. We can move on to questions.
Ma'am, I have one question. If there is any deformities in the bone, especially in the toes because of low bone density, and the toes little bit protrudes out, and it can be also in the fingers where the joints is deformed, mostly in the old people. So if there is supplements which are given, calcium supplements, and also some form of exercise is given, is this reversible? Can the bones come back to their original shape by any way?
See, we were discussing today about low bone density. We were discussing about reduction in the bone density. But the condition that you're talking may exactly not be low bone density. You're talking about the deformity. That could be a different condition. But of course, for building the bones, there are certain way. As I said, that I have discussed various factors and approaches, right? That will help in building bone. But what I understand from what you're saying may not exactly be low bone density. That could be a different condition altogether.
Just the clarity on whether this is reversible or irreversible. If once it
Well,
happens, then if measures are taken for correction, is this reversible in any form?
So addressing this question, excuse me, Gautami, shall I answer this question?
Yes, sir, please.
So deformities in the sense of, in the case of osteotypes, we are classifying it as a osteotypes. Osteotypes means it will, some degeneration will take place. So in
Okay.
that case, you have to depend on sometimes for healing process. So that healing process depends upon some alternative medications or allopathic medications is required. So this is also based on the age factor. So what is the age factors? Suppose it is in middle age, there is a possibility of regeneration. Otherwise, if it is in old age, then in the case of we have to depends on the supplements. So in that case, the regeneration will takes more time. Okay.
Okay.
So
Okay.
we have to allow to heal that particular regeneration of the bones. Then after that we can do yoga. Then it will be helpful. So I
Okay.
am addressing your question. Okay.
Okay. Thank you, sir.
Thank you so much, sir. Do we have any other questions? We'll take one or two maximum because we are at the end of the time already. We crossed 5 minutes.
No questions, sir, but I just want to congratulate Gautami. That was a very nice presentation and very well researched, Gautami. Thank you so much.
thank you. Thank you. Thank you. Thank you.
Thank you, ma'am. Very wonderful session.
Yeah.
Thank you. Thank you,
Conclude,
ma'am.
today, like Gautami ma'am discussed with the yoga for bone health. That is the low bone density and the osteoporosis. She has discussed few topics. I mean, most of the topics which has been covered on the bone remodeling, normal bone density and the low bone density, the anatomy, physiology, as well as developing a practice for a healthy bone. Okay, I would thank Gautami ma'am. Before that, I would like to share my screen to show the next upcoming webinars. Okay, like I have seen few people have joined the Sangha group because more and more information will be available in the Sangha WhatsApp group. So you can take down my phone number in case if you want to be a part of the Sangha group so that you will be like getting all the information about the next few webinars. I'm just sharing my screen before we end up the session. So next webinar for the month of June, we have 5. Again, the theme is for the Yoga for One Earth, One Health for the upcoming June 21 Yoga Yoga Day celebrations. So 1st of June, the topic is the sacred syllable, which will be dealt by Dr. Venkatakrishnan. And the next topic will be by Dr. Smita, which is on MSRT Advanced Meditation for Stress. And the next will be Surya Namaskar by Warrant Officer Abhijit Bose. And next topic I will be taking on Hypnagogic, which is Yoga Nitra, Kaushik, Dr. Kaushik, and Hatha Yoga at the end on June 29 by T. Saraman sir. So please make a note of my number. So in case if you want to join the Sangha group for more information on the webinars, definitely you can ping me so that I can add you in the group. My WhatsApp number is 99 625 65 850. I repeat it again, 99. I'm also putting it in the chat, 99 625 65 850. And again, I would like to thank Gautami ma'am and all the participants who made this webinar a successful event. We saw like approximately like 62 on an average, but more than 120 actually joined. I could see in the Zoom attendance. On an average, it was like 60. And thank you all participants for joining every week and making this event a very successful. We are marching towards the Yoga Day, and we are happy to glad to be part with you. So we will end up the session webinar today with the closing prayer. Okay. Sit in a comfortable posture, shoulders relaxed. Everybody like right now how to sit. We're not going to suppress our spine anymore. Comfortably, chin tucked in, eyes gently closed. Deep inhalation, relax while exhaling. Inhale, exhale. Asato ma sadgamaya, tamaso ma jyotirgamaya, mrityorma amargamaya. Om Shanti, Shanti, Shanti. Again, thank you, Gautami Darvesh ma'am, and all the participants.
Thank you, sir. Thank you for the opportunity. Thank you for the opportunity. Thank you very much.
Thank you all. Have a great day. Hari Om.
Hari Om, sir.
Thank you very much.
Wonderful session.
Thank
Thank you so
Gautami,
much.
ma'am. Thank you, sir.
Thank you, sir and ma'am.
Thank you, ma'am. Thank you.
Very
It
useful
was a
session.
wonderful session. Thank you, Gautami, ma'am.
Thank you.
Thank you, Gautami, ma'am.
Thank you, ma'am.
Thank you. Thank you.
Thank you all. With this,
Thank
we
you,
are closing the session. We'll meet the next week, Sunday, 10 o'clock. Okay. We'll be sharing out more information in the group. Thank you all. Hari.